Hey everyone, this is Dr. Jin, and today we're watching a video about illegal butt injections that could kill you.
My name is Carmelo. I'm 23 years old. I have a 4-year-old son, and I'm addicted to butt injections. Before the injections, I was a size 4, and now I'm in a size 10. I am happier because I never had a butt. It was nice and firm and up how I wanted to be up. I picked up more attention than before as far as comment on my butt or something like that. It definitely steps up my confidence.
Over the last 3 years, Carmelo's had 54 buttock injections, yet she's never bared her behind to a plastic surgeon. She receives her shots on the black market, getting pumped with an unregulated substance that's been known to include metal lubricant and cement.
Why would anyone do that? That's crazy. No, I understand kind of the self-confidence thing, and I think we as human beings all want to do things that make us feel confident, right? But you know, it's when you fail to realize that this could be life-threatening or dangerous. That's dangerous. Yeah, it really is. I mean, I've heard about these stories, and you know, you hear this all the time about people going to unregulated places like in Miami and stuff like that, and people getting in trouble, right?
All it says is liquid silicone, but I don't know for sure.
Carmelo's addiction pisses me off.
Yeah, she's probably getting liquid silicone injected, but it's silicone that we'd use in like construction and things like that. It's far from anything medical grade.
After an infection nearly killed her, she's worried Carmelo won't stop until it's too late.
Every time you go get injected, you roll that dice to see if you're going to be one of the ones that is going to get sick and die.
And Carmelo and Vanity aren't the only people to be addicted to buttock injections. In 2011...
Sorry, but that doesn't even look good, right? Yeah, but I mean, beauty's in the eye of the beholder, so again, you're rolling the dice on that.
A woman was charged with practicing without a license after administering hundreds of injections to women across the country, including herself.
Yeah, injection of metal lubricant and cement can lead to blood clot, strokes, and amputation. Oh yeah, of course, right? Or even worse, you can die from it. The most common types of symptoms would probably be some type of skin infection, like a cellulitis, right? Or an abscess or an ulceration of the skin. That's probably going to be the primary or most common symptom, right? But before you die, you're probably going to suffer all these things along the way. It's crazy what's going on here. I think the bigger issue here is, you know, it's each individual kind of and what they perceive as beauty, but also too, maybe it's a lack of accessibility to qualified professionals or plastic surgeons to actually do these procedures. It could be a combination of things, and that we're not quite sure. But I think anyone would advise against these kind of black market, any type of injections, whether they're in your butt or in your face, right? I think if you're not getting these injections by someone who's licensed, who is trained, right, and knows how to deal with complications, then you are really rolling the dice.
Carmelo has hidden her addiction from her sister, but has decided she's finally ready to reveal the truth and get her advice.
The reason why I want to come over here is to tell you, I've been getting butt injections.
What doctor do you go to?
Actually, I don't go to a doctor. It's a lady who I heard from some other girls. We just meet at a local hotel room.
It's not normal for people to just meet up in hotel rooms and get butt injections. You know that, right? So...
Yeah, it's crazy. She's saying they meet up with this injector in a hotel room for these injections. Again, these are just... From a common sense point of view, these are all red flags, right? But it's unfortunate that, you know, certain individuals like her, they just can't see past that.
Do you know what she's putting in you?
I only know about what she tell me, which is liquid silicone.
Does that worry you? Because she can be putting jelly in you for all you know. I'm kind of like dumbfounded by it.
I'm definitely worried, but I'm not all the way comfortable with my body. I still feel like I need to get it at least one more time. I guess she kind of opened my eyes up a little bit about my health, but you want to feel comfortable in your own skin. I just still want to get them.
Right, we all have our own insecurities, right? So having any type of support system is key. Intervention, sure. Counseling, yes, right? But everyone responds to it differently, right? So if you extrapolate this to someone who is maybe dependent on alcohol or any other substance, right? No matter how much you tell them, oh, you need to quit, you need to stop, right? But they just go right back to it. So again, it's one of those things where it's a long road to recovery, right? And I think the only one that can really get through it is the person themselves. But again, if you don't have a good support system around them, it's very, very difficult. Yeah.
Your shot lady, she just got indicted. She was lying to you, she was lying to everybody else. Aren't you mad that she was injecting you with industrial grade silicone?
I always heard about her, like, you know, messing other girls up and stuff like that. But to me, in my head, I'm like, no, I need this injection ASAP. I need to get just a little bit more bigger. I'm very uncomfortable with my body.
Yeah, and you know, her kind of not thinking or coming to a realization of how dangerous it could be, it's probably because she hasn't had any bad effects or side effects from it, right? So she's like, oh, I've done it once, I've done it twice, I've done it 50 sometimes, and I've never had any bad effects, right? Aside from these occasional headaches that I've gotten, but nothing catastrophic has happened. So in her mind, she's probably thinking, oh, what's the big deal, right? I've done it so many times before and nothing's happened. But again, I think that's what kind of blinds people, you know, and that's the dangerous part, because it's okay until the point when something bad happens or something catastrophic, right? And that's the problem. Once you reach that point, something catastrophic does happen, sometimes there's no coming back from it, right? But sometimes people don't realize that until you finally get to that point and you've gone too far, unfortunately.
I think that the only thing Carmela can do is just be bigger than her addiction. She has to realize the biggest thing in this situation, which is her son and which is her health. The health problems that can arise from this can take any one of us out. So how do you feel knowing that, you know, one day it may happen? And I think that you should go to a doctor and find out what was injected inside you.
I will go. For your concern, my son's and my own, I will go.
If this person ended up in the hospital, what kind of treatments would they undergo to kind of fix that issue?
Oh, that'd be difficult. It all depends on how sick they are, right? Two, how long the material's been there, right? Because if you have a component of oils, silicone, cement, or hardening agents, there might not be anything that you can do at that point. And it's just there, right? Because again, even for a medical procedure to say remove something, you have risks and rewards, right? Or risk benefit. And sometimes the risk might be greater than the benefit of actually taking it out, right? And you saw some of those pictures or the videos of the women who've gotten these butt or gluteal injections, and some of them look very unnatural and very disproportionate, right? And that's something where the body probably can't metabolize that. You can't break that down. So it's there, right? It's gonna be there, and right now they're a lot younger, and it's gonna be there in 20 or 30 years, right? That same amount of mass is gonna be there. It's not gonna break down. It's just gonna sag more, right? So you're just asking for more trouble.
What brings you in today?
I had got some butt injections a little while ago.
Okay.
And I wasn't quite sure what she was injecting me with.
Do you have any idea what she injected you with? Did she tell you?
She said liquid silicone.
Okay.
But I'm not sure if that's really what it was.
Did she do anything afterwards? I mean, did she stitch up the incisions?
She put super glue, then cotton balls on each shot that she gave me.
You're literally putting your life in the hands of somebody who sounds like they are completely unlicensed, untrained, and they could be injecting God knows what into you. You've got some abnormalities on your x-ray. You can see here, this is your thigh, the fat in your thigh, which is smooth and normal, but up here it looks kind of spongy, this texture, and that's definitely not normal. So even though you're healthy, it just takes one bad injection to literally kill you. If it's a substance that's not sterile, you could get some major infections. It can enter your bloodstream and it can literally clot up your lung. And within minutes, you can die. And that's it, end of story.
Right, it's sometimes you have a psychological dependence on something. You know it's wrong, you know there's risks inherent with it. You know there's bigger things that are out there to live for, like family. But again, can't get over this kind of psychological dependence, right? And that's the unfortunate part. So am I convinced that she's going to quit and stop? You know, I hate to be a cynic, but I don't think so, right? And it's until something like a big side effect happens that maybe she really starts to think and rethink this.
What do you have to say to the black market injectors that are doing this kind of thing?
Well, I don't agree with what they're doing, right? But people resort to doing crazy things that people are willing to pay for, right? So we're talking about black market injections. You could talk about other things that people do that could be even stranger or like even more dangerous, right? But because there's a market out there for that, people are going to be doing it. Thanks for watching. We should all think twice in terms of getting any type of procedure, whether it be a butt injection or anything else, from anyone who isn't licensed, who isn't trained, because again, the risk versus benefit, you never want to gamble and take that chance.